Hi, guys. How are you? Dr. Pam, owner and founder of Academic Coaching for World Changers. I thank you for tuning in for a video. Really, we always like to make sure that you understand the questions. Most of our clients, we think, own way too much material. You have spent so much money on material. And somehow you think if you keep buying more books, you'll understand it. We're aware that many of our clients really just sometimes need a teacher. I think all of us are aware of that. I have a trainer. Do I know how to eat? Yes, I do. Do I know I'm supposed to exercise? Yes, I do. I have a trainer because he reminds me, he holds me accountable, and he also it makes sure that I understand. Because a lot of times he uses terms about muscles, that technical jargon that I don't understand. Especially recently, I tore my MCL. It's the inside. The ACL is many times what athletes do. Old people like me, I tore my MCL. What I didn't know is that ligaments don't go back into shape. Tendons do, ligaments don't. So what he taught me was the importance of building my muscle around my leg. All of us many times just need a tutor, a coach, a mentor, someone to help us get through. At Academic Coaching for World Changers, we will never make you a better therapist. That is never our goal. Being a good therapist is excellent supervision and time in the field. That simple. You got to make a couple of mistakes. You do. Non-malfeasance for my counselors means I won't purposely do any harm, but I'm learning and I definitely will make some mistakes. I pray that I never hurt a client because that's always about the test, always about never hurting a client. However, it's really okay to acknowledge that you need a coach. What I do find sometimes confusing is why my clients will spend money on coaching for their kids. They'll get the best baseball coach, they'll get the best singing coach, they'll get all of those things, but they won't spend money on themselves. And that baffles me. And as a mother, I understand the priorities, but as a mother, also, I understand going back, I really would have put more information and more effort into myself because that's what my kids needed to see. That's the seed I was planting, is that I'm important. So thank you for tuning in, and thank you for tuning into this brief question. Remember, invest in yourself. You are worth it. We recommend 90 days of studying. What? 90 days? Absolutely. 3 hours a day, 3 separate hours a day. We recommend that you watch our videos. We recommend that you pick one video that you like and watch it over and over and over again. Research says that you really don't hold on to any information more than an hour. I know, more than an hour. So what you're going to do is you're going to pick a video that you like. You're going to watch it an hour in the morning on your drive to work while you're showering. You're going to watch it again at lunch, and then you're going to watch it night before you go to bed. If you have drive time, that's perfect. You can skip like the lunch ones, but the one we don't want you to skip is the nighttime. Research really says that what happens right before we go to bed, we replay in our mind 10 times more often than we do what happened in the entire day. That's the research of why you tuck your kids in bed tonight. That's the research of why you put a happy picture before their bed, because the last thing they see before they go to sleep is going to be that happy picture of the happy family. So we really want to get you to do this test once. Our research is our testing is based on research. It really is. We've done a lot of research on neuroplasticity and how the brain works. And we're not teaching you anything new. Remind you, we're not teaching you anything that you don't already know. You already have a master's. You might not have learned a lot, but you're the smart kids. You're the smart kids. I know that because you don't know how to study. Let's get into our question today. Okay, so I'm going to remind you, when it comes to questions, there are 2 types of questions. There are application and there are recall. Back in the day, for any test, there used to be a lot of recall questions. Who is Freud? What are Freud's 4 stages? Can you tell me what mistrust versus mistrust is? Very basic. We don't see those anymore. What people tell me is they're vague. They're very vague questions. So when it comes to application, which is the majority of the questions, we're going to remember that we assess. We assess, we assess, we assess. Remember, the way that counseling works, whether it works at your agency or not, the way that it works for the test is there's an intake. The intake person is not you. That whether it's done on the phone or they come in, somebody has met with them and talked about insurance. They've talked about our rules. We've talked about, are you in our catchment area? Are you in the zip code that we can treat? And do we have enough staff, or do we treat what you're presenting for? That is the intake, and that's done before they get to you. Okay, for the test. I don't really care what happens in your world for the test. So now the client comes in and you're ready to do the assessment. Remember, if the client comes in to do the assessment and they are boo-hooing, they are bawling, they are so hurt, you're not going to pull out your clipboard and start asking questions, are you? You're going to be human and you're going to check to see if they're okay. You're going to ask them, hey, you have anything you want to talk about, or can you tell me what's bothering you? So we're always going to make sure that it's full of feelings. We're going to address the feelings first. And of course, safety trumps everything. Always, always, always. Safety trumps everything. I'll remind you for the code of ethics, safety trumps everything if someone's in imminent danger of hurting themselves or someone else. If they hurt someone and they're buried in their backyard and happened 5 years ago, that's not imminent danger. I don't report that. I know I'm the secret keeper, right? I don't report that though. I keep that with me. Okay. And when they go to court and the judge tries to subpoena me, I am still going to say, Your Honor, my client told me this in confidence. The legal term is privilege. And I'm going to ask the judge to please not make me share. He may make me share, but again, I don't do well in jail. If you watch any of my other videos, Dr. Pam likes to sleep naked, and I want to watch what I want to watch on TV. Not doing jail. Not at least for somebody else's crime. So again, assess, assess, assess. We're always going to plan with the client. You might see questions on planning, right? And remember that my theoretical orientation, as well as the diagnosis, drives the treatment plan. The client are going to work together, of course. We don't ever tell a client what to do, but also many times we have to narrow that treatment plan down. I've had clients who come in and they've been out of prison after 20 years, and their first goal is to buy their mama a house. That's a lofty goal. However, let's start with getting a driver's license, right? And remember, we're going to use SMART goals: specific, measurable, achievable, realistic, and time-based. So we're going to assess with the client. We're going to assess the client. We're going to make the treatment plan with the client. Our intervention is based on our theoretical orientation, whether I'm a Freudian, whether I'm behaviorist, and those are the questions that you're looking for is what do you do? And then remember, termination starts at the beginning. If it's a 12-week plan, if it's a hospital stay, if I am doing solution focused, I know I only have 6 to 8 weeks with this client. So termination starts at the beginning. Our goal is always to teach people how to fish, not give them fish. Okay. The other way that we answer questions are going to be recall. Recall questions are you just have to know the material. A lot of the recall questions my clients struggle with are just from not knowing content. I cannot tell you how important it is to know content and to increase your vocabulary. What I will say to you, and I'll say to all of my clients, keep your closed caption on the TV. When you have a session with me, and if you're watching this YouTube video, turn on the closed caption. Learn the verbiage. Missing words will definitely not help you pass the test. And if you're not sure what it is, especially when you're taking a test question that's not really studying, Google it. Contraindicated is a very common term that people don't know what it means. It means not recommended. ADHD, if a client has ADHD, we know that Prozac is contraindicated for ADHD. If I don't know that word, it can cost me the question. Okay, so we've got 2 types of questions that are going to be recall, which uses Bloom's taxonomy. If you've ever been in education, took a couple of education classes, you know this. We try to remember or understand. A lot of my clients spend so much time trying to memorize, and that just doesn't work. The goal is that we need to learn the information to apply it. And then sometimes we have to analyze the questions. Those that don't give me any name at all, they just give me a term. I have to be able to analyze and figure out what they're asking me. So we talk about, again, either application questions or recall. You're going to find the majority of questions are application questions because we're supposed to do higher level thinking. Okay, and I'm going to remind you always, 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 it's a reading test. It's a reading test. It is a test that everybody gets the exact same test. We don't care what happens to your agency. One of the most common questions is whether or not I can take a gift. My agency says $25 or less. The code of ethics doesn't have a dollar value at all. Read the code of ethics. Read the question. So the code of ethics says if a client wants to give me a gift, I'm going to look at the reason they want to give me the gift, the reason I should take the gift. I'm going to look at any cultural or diversity issues, and then I'm going to make a decision. Okay. There's no monetary value, but it does say a small gift. Okay. So just understand what the code of ethics says. Read it for yourself. As we go through all of these questions, I'll remind you it's a reading test. Here we go. So this question, this is just a recall. It says, it is likely that a patient diagnosed with seasonal affective disorder will begin to experience fewer symptoms in which season. Before I look at any of my answers, I'm going to go back to my question. It is likely that a person with SAD, seasonal affective disorder, will begin to experience fewer symptoms in what season? Fall, winter, spring, summer. Now, a lot of you will just pick that answer and go. I don't recommend that. I recommend that you go through our process. If your answer is right, it won't change through our process. We're not going to change the answer if it's already right. So this is a not question. Do you recognize that? So in 3 of these questions, that is when the sad feelings will be worse. And the one that it's not worse is the not question. So fewer, least, all of those things are not questions. So I'm going to look at the 3 things that are true before I pick the answer. But again, if you're going to use test questions as study material, we're going to learn about it. So again, if you want to go ahead and click your answer, feel free to stop now, click your answer, and come back and watch the video later. So first of all, I want to know, what is the question asking me? I tell you all the time that every question measures a knowledge, skill, or ability. Whether it's on the NBCC website or the Social or ASWB website or whatever test you're taking, there's a list of knowledge, skills, and abilities that you're supposed to know. If you went to an accredited school and you have to be taking this test, there's a list of things they're supposed to teach you. Every question is measuring something. Just because it's written in a group style doesn't mean it's a group question. It could be a code of ethics question written in a group style. So let's stay with the question and try to focus on what they're really asking me. So what is SAD? Dr. Pam definitely knows what SAD is because I suffer from SAD, seasonal affective disorder. Not everybody has it during the same season, but most often it's going to be during the winter months when it's cold and there's no sun. Seasonal affective disorder is a type of depression that's related to changes in the season. SAD begins and ends about the same time every year. If you're like most people with SAD, my symptoms start in the fall and continue in the winter months, sapping my energy, making me feel moody. The symptoms often resolve during the spring and summer months. What you'll find is Dr. Pam travels to the Caribbean during the winter months. For Thanksgiving, I was in the Bahamas. For Christmas this year, I took my kids on a cruise, and I'll probably travel again in either January or February. I cannot live without the sun. I would lay in bed and hibernate like a bear. One of my friends said to me one time, you have to stick up lots of things up your bottom so you don't have to potty. You eat and eat and eat and you don't potty. I'd be okay with that. Just leave me alone. Put the cover over my head and leave me alone. I don't like cold weather. I don't like it. I like it in the beginning of fall when I get to wear like boots and look kind of cute for a couple of days. But when it's really cold, I want to die. I do. I do. Dr. Pam has always been very transparent. I'm on an antidepressant, and it gets worse in the month. So we treat it. I'll talk about that in a minute. Okay. So less often, SAD causes depression in the spring or early summer and often resolves during the fall or winter months. Less often, SAD causes depression in spring or early summer. So that does happen, but that's not the typical diagnosis of SAD. And unless the question says something different, I'm looking for the typical DSM diagnosis of seasonal affective disorder. We find it with people who many times lost someone during that holiday season. Mother's Day may be a time that you're sad, maybe your birthday, things like that. So it's around the season. Okay. So what is the treatment for SAD? Okay. So the treatment for SAD, let me go back. Let me give you a little bit more about SAD. Okay, there we go. My slide was out of order. So knowing that SAD affects millions of people each year, how do you know if you're at risk? I can tell you, for me, I lived in South Florida for most of my life. Sun all the time. 60 was cold, but there was still sun. So if you live in the north or northeast, where seasonal changes and winter are more pronounced than in summer climates, at the time of this recording, it is January of 2025, and it is a snowy day. I like snow for about 15 minutes. But then after a while, the sun goes away and it's dreary and the snow gets dirty, and I go back to being sad. Okay. Persistent feelings of sadness, hopelessness, or irritability. Now, hopelessness is many times a red flag for suicide. So when you see a question and you see hopelessness, that helps me bring my attention someplace else. You also get changes in sleep pattern, either trouble getting a good night or sleeping more than usual. I could sleep all the time. I could just sleep all the time. Loss of motivation, interest in activities that I once loved, and fatigue or low energy. I want to stay in bed with a cover over my head. Okay, so treatment. So for me, and I don't know if you can see it or not in this video, I use light box therapy. Light box therapy is the most common thing that you'll see when it comes to treatment. Light box therapy mimics the natural sunlight in short supply than that's in short supply in the doctor months. It gives my brain a dosage of sunshine. The lamp helps regulate my mood, my sleep, and my attitude. Okay. So it's supposed to mimic the sun. So that is the number one treatment, light box therapy. That is, again, this is just a recall question. Okay. But there are other treatments. I said to you before that I am on an antidepressant. I'm on an antidepressant year round because life is hard. But also remember, seasonal affective disorder is still a mood disorder. It's still a mood disorder. And we treat mood disorders with CBT and meds. That's always the right answer. So when we look at any mood disorder, mood affect, right? Major depression, bipolar 1, bipolar 2, anxiety, seasonal affective disorder, dysthymia, and now it's called persistent depressive disorder. CBT and meds is the evidence-based treatment. Okay, so that's always a test question. Which one is evidence-based? There are other treatments that are evidence-informed. That means that we've used evidence to find it, but it's not been around long enough to be evidence-based. Okay, other changes, lifestyle changes, regular exercise, eating healthy, maintaining a consistent sleep schedule can improve the symptoms. Also, more vitamin D. One of the things that we know is, and I am not a doctor, I'm not that kind of doctor, so please don't say, Dr. Pam, talk to me about nutrition. However, vitamin C is what we get from the sun. And if I don't get enough sun, then my body has a difficult time absorbing my vitamin D. Okay, so vitamin D supplements, and that's really something you can ask your doctor for. They're over-the-counter supplements. However, I'm not giving you medical advice. I'm saying that they're supplements, and for the test, those are the right answers. Again, I'm trying to understand the question, okay? I left it out there, sorry. So when, again, I'm back to the question, she's looking at a light box. So I apologize for leaving that out. You can't see that video. So now I understand the question. I understand the question is asking me, it's a recall question. It's asking me in the, which of the seasons am I least likely to suffer from seasonal affective disorder? Okay. So like I said, with every question, I'm going to rule out. I'm going to rule out. I'm going to read the question again because it's a reading test. It is likely that a patient diagnosed with seasonal affective disorder will begin to experience fewer symptoms in which season? Fall, winter, spring, or summer? I think that's a song. Winter, spring, summer, or fall. All you gotta do is call and I'll be there. I'll stick with my day job. Again, I'm going to rule out the two. We know the answer because we spent time going over the content. So you should not miss this question, and you should not miss any question again on seasonal affective disorder because you use the question as a study guide, not just as a test question. Okay. Of course, the answer is spring. A couple of reasons. SAD symptoms are closely linked to exposure to sunlight. As spring arrives, daylight hours become longer, which typically help regulate the body's internal clock. My circadian rhythm. By the way, what that means is I should sleep at night. I should sleep when it gets dark and wake up when it's light. That's your circadian rhythm. In one of the test questions, when it talks about normal human behavior, it talks about the circadian rhythm of adolescence. Adolescents should not start high school at 7 a.m. That's based on research. It's gone back from way back when the adolescents had to help in the field. So they got to school early so they could come home and work in the field and help their parents. But new research says that we don't need schools starting that early because teenagers, adolescents need as much sleep as babies. Their body is changing so fast. Normal human behavior. Okay. So again, winter is not the answer because SAD symptoms are at their peak during the winter months. The days are the shortest. When I leave home and it's dark and I come home and it's dark, I want to cry. Summer, when symptoms are generally alleviated by summer, patients start to feel better. And D, of course, fall is when they are beginning to start. So while summer is true, the best answer is going to be in the spring. I hope that you enjoyed this question. I hope that you enjoyed this video. I hope that you take this test just once. I want to just give you some encouragement for those that have taken the test more than once. It is not an indicator of whether or not you're a good therapist. It is not. It is not. It is not. It's an indicator of whether or not you're a good test taker. Let us make you a good test taker. There are skills that you need to know. There are things that you cannot bring in the test. There's factual information you just need to know. The one-on-ones are probably the best way to learn. I could learn anything. I could be a brain surgeon if you taught me one-on-one. We do realize that that's sometimes out of the client's price budget, so we do recommend small groups. We do have a weekly group every Saturday that ranges from between, I think it's about $35 at the time of this recording, and it ranges between 10 and 30 people. But you still get a live session and you get to ask me questions. We offer boot camps, which are 4-hour overviews of what's happening, and you can join one of those. And the best things that I think are the prep courses. The prep courses are designed like a semester. It's 15 weeks worth of semester. We go through the material that is needed in 15 weeks. I'm going to give you a study assignment. I'm going to tell you what to study, how to study, and we're going to come back every week and then ask questions on that. This test all licensure tests are not supposed to be easy. They're not. I don't want my nail tech, my vet tech, I don't want my doctor to have passed the easy test. I don't. I want them to have struggled. It's okay to struggle. Just don't keep doing the struggle over and over again. Let us help you. You can find us. You can search Dr. Pam. Actually, if you just put in Dr. Pam on Google, I'll come up. I'm on LinkedIn. I'm on TikTok, all those social media. And of course, that's just our website. And please find us. You can email us at drpam2020@gmail.com. Guys, thank you for being world changers.